Greetings and salutations. Thank you for lending an ear to the Voice of the Times this Monday, January 25, 2021. For today's editorial, time to address issue of false positives in Covid PCR testing. The Interagency Task Force for the Management of Emerging Infectious Diseases, or IATF-EID, and the Department of Health should take time to study and take to heart a major decision of the World Health Organization, or WHO, to change its guidance in testing for the coronavirus disease 2019, or COVID-19. Sometimes it seems to us that major developments in the world's understanding and progress in the struggle against the coronavirus pandemic do not sink in on the IATF-EID's members and its subalterns. They just go on doing the same thing. When hundreds of the world's epidemiologists, medical scientists, and health policy specialists issued and signed the Great Barrington Declaration, which called for a new strategy and policies against COVID-19, the IATF-EID hardly adjusted a single letter in its community quarantine playbook and health protocols. When scientists and economists came out with fully documented research studies that as many people were dying worldwide from lockdowns than from the virus itself, our health policymakers and administrators did nothing to change the balance between the two. When the great and hopeful news came out that medical science, technology, and industry would be able to develop and manufacture in record time not one but several vaccines against COVID-19, the IATF-EID turned its attention to cautioning our people against thinking that the pandemic would soon be over. It made no change in its pandemic timeline. We find it necessary to say all this because the WHO has just announced a new guidance for health experts and policymakers that it has changed its official criteria in testing for the COVID-19 virus. This policy decision is of surpassing importance. First, it cautions governments and health organizations against reliance on the polymerase chain reaction, or PCR test, to detect the severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2, which causes COVID-19. In the updated guidance, the WHO said lab experts and healthcare practitioners should also consider the patient's history and epidemiological risk factors alongside the PCR test in diagnosing the COVID-19 virus. Diagnostic testing for SARS-CoV-2 states that careful interpretation of weak positive results is needed. The cycle threshold needed to detect virus is inversely proportional to the patient's viral load. Where test results do not correspond with the clinical presentation, a new specimen should be taken and retested using the same or different NAT or nucleic acid testing technology. Experts say the new guidance could result in significantly fewer daily cases. Most PCR assays are indicated as an aid for diagnosis. Therefore, healthcare providers must consider any result in combination with timing of sampling, specimen type, assay specifics, clinical observations, patient history, confirmed status of any contacts, and epidemiological information, the guidance states. It's not clear why the health agency waited over a year to release the new directive. What is plain is that the WHO finally acknowledges the reality of false positives emerging from the PCR test. Scientists and physicians have long raised concerns about an over-reliance on and a misuse of the PCR test as a diagnostic tool, since it can't differentiate between a live infectious virus from an inactivated virus fragment that is not infectious. In the Philippines, it is certainly time for the government to address the issue of the false positive in our COVID testing system. The health department does not speak of it in its daily reports on increases in COVID cases or infections. It has never recognized the fact that its data could be riddled with error. Prior to the pandemic, for individuals to be considered a case, they must test positive and show clinical signs and symptoms. But to be counted today as a COVID-19 case, only a positive PCR test is required. The WHO is now advising that a positive PCR test that does not correspond with the clinical presentation should be verified by taking a new specimen and retesting it. And that's the editorial for Monday, January 25, 2021. For more news and information, get a copy of the Manila Times on print, subscribe to our digital edition, or log on to www.manilatimes.net. Follow us on Twitter, Facebook, and Instagram. And listen to the Voice of the Times.